This is Charter Local Edition. My name is Brad Pomerance in the nation's capital. Always good to welcome back John Barrasso. He is a member of the U.S. Senate representing the state of Wyoming, and he is a doctor. And it's always nice to interview a doctor in the U.S. Senate as opposed to a lawyer. I used to be a lawyer, so it's good to interview.
Great to be back with you. Thanks for having me.
Absolutely. I want to speak with you about healthcare, healthcare reform. When you look at the Affordable Care Act, lots can be said about it. But what we do know is, as it relates to premiums, it seems as if premiums are going up in some places, down in other places. What's happening in Wyoming? What do you hear on the ground?
Well, I'm in Wyoming just about every weekend. And as a doctor, I see former patients and friends. But no matter where you are in Wyoming, you get to talk to people about it. And this is a big concern. Because the president promised, if they passed his health care law, that premiums would go down by $2,500 a family. And what actually has happened in Wyoming, costs have exploded as they have across the country.
And that's what's frustrating, because in some places like Denver, premiums went down. In Nashville, apparently in Wyoming, premiums went up. Is there a method to the madness? Do we have a sense as to why in some places but not others?
The concern that I'm hearing in Wyoming is that the president decided that he has a better idea of what people need than people do. And it was at the Wyoming Stock Growers meeting, you talked to ranchers who had insurance that worked for them, but then they lost it because it didn't meet the president's mandates of all of these, what he called essential benefits, I call excessive benefits. So people now have insurance that they're paying more than they were before, plus the deductibles are higher, the co-pays are higher. That's why this law is still so very unpopular all across the country, because the president really didn't keep his word.
What we also know is that part of the reason why premiums are being driven up are these new wonder drugs, which we support. I mean, it's wonderful that an illness like Hep C is now being cured through a drug called Sovaldi. As a physician yourself, you understand the importance of innovation. But these wonder drugs are expensive and driving premiums up. What can be done on that front?
And with a hepatitis drug, as you say, it's $1,000 a day. You need to take it for 12 weeks every day. Huge expenses that weren't there before. We're always looking to find new ways to cure problems, and whether it's Alzheimer's, whatever we are as a country due to the advances in medicine, living longer, all of us, healthier lives. But there's a significant expense to that, and the promise under the health care law is that costs would go down. That wasn't true. People knew what they wanted with health care reform. I hear it every weekend in Wyoming. They want the care they need from a doctor they choose at lower costs, and they didn't get it.
But on this one issue of drug and drug costs, is there a way? And the reason I ask is, you all in Congress must be incredibly proud of the fact that you came together in a bipartisan way and addressed the issue of Medicare and reimbursements. And I've spoken with many of your colleagues, and it really is a source of pride. So Congress can get together and fix a problem. Drug costs, a problem. Premiums, a problem. Can you get together under this presidency, because he's still here, and try to solve the problems that the Affordable Care Act has?
Well, I want to find a way to find affordable health care for people. Mike Enzi, the other senator from Wyoming, is the champion on the HELP committee working on this, but we really don't have a partner in the White House who is willing to work with us. He continues to give speeches saying that the health care law is working wonderfully and people should forcefully defend and be proud, but he doesn't pay attention to the fact that so many people are finding that they are paying more. And I want to have a partner to work with to find the solutions to give people the care that they really need at lower cost.
I want to ask about Medicaid. As you know, your governor has been willing to look at expanding Medicaid in Wyoming. A lot of Republican governors have looked at that possibility and tried to create plans that work for them, not necessarily taking the expansion as the federal government suggests, but public-private partnerships. In the end, though, even though the Wyoming governor was looking at expanding, the Wyoming State Senate opted against. Now, of course, you're not in that body, but what do you make of this, that some Republican governors, including yours, is looking to expand, but it's the legislatures that are not moving forward?
Well, I was in the Wyoming State Senate
for
5 years. It is a terrific institution, and the thing that's so interesting with Medicaid expansion is that Washington has said, well, we'll pay for several years for all of it, but then sooner or later, the expense is going to be on the state. And what I saw when I was in the state Senate is the state was asked to bear more and more of that burden of the cost, which then takes away money that could be used for education in our schools, for safety, for highways, all of those things. So I think members of the Wyoming legislature were concerned that if you sign up now, and we want to do it on Wyoming's terms, when Washington comes out with a one-size-fits-all, that hardly ever works at home in Wyoming.
But I understand, I think Indiana Governor Mike Pence, a Republican, did it more on his terms. He worked with the federal government, got the waivers necessary. Again, I know you're not, a member of that state legislature. You can only do so much. But, if you spoke to your colleagues, what would you recommend? Can we do it Wyoming's way in terms of the expansion?
Well, you said the right word with Indiana, which was waivers. I mean, you have to go and essentially ask or beg Washington to let you do it the way that works best at home. And people of Wyoming, I think they ought to just be able to do it that way without having to say, every time we want to make a change, anyway, we want to say we know what works best in Wyoming, that we have to turn to Washington. That's the way I felt when I was in the Wyoming legislature, and that's certainly the way people at home feel, and I hear about it. I hear about it every weekend.
No doubt Wyoming is one of the most beautiful places in this nation, with beautiful rivers and creeks and bodies of water, and there are many members of the Senate, both Democrats and Republicans, in a very bipartisan way, that are very concerned about a rule that's been promulgated by the EPA called the Waters of the United States Rule. And as I understand it, the EPA was looking at addressing some Supreme Court issues that confused what the rule was. But what we know today is the EPA is looking to expand the definition of their jurisdiction. What can you tell us about the Waters of the United States Rule?
Yeah, and not just the definition they want to expand their authority, their reach, their control. Oh, and right now the law is that waters of the U.S. are navigable waters. Now we know what we think of as navigable waters. The EPA wants to expand that to basically puddles, prairie potholes. Just about any time it rains, you are going to have on your land waters of the United States based on their definition. I have bipartisan legislation that says, no, we're not going to tolerate this, and get it back under the control of local folks.
And that's an understatement a bit. I mean, when you say bipartisan, sometimes, I have one member of the other party. You have a few.
We do.
I mean, you have Joe Donnelly from Indiana, you have Heidi Heitkamp of North Dakota, you have Joe Manchin of West Virginia. I mean, this truly is. So if you
and it already passed the House with 24 Democrats voting in the support of this.
I've spoken with some of your friends in the House, and they're kind of smile like, well, I don't know what the Senate, the upper chamber is doing. So what's the upper chamber doing? I mean, to deal with this issue.
Well, I've introduced the legislation. We've had a committee hearing and then a vote in the committee. It is now passed out of committee, and we're working our way to the floor of the United States Senate, because people in Wyoming clearly know water is personal, and water has to do with the land as well. If the government comes in to control water, it controls your land.
Do you have a sense where the executive branch is? I mean, we know the EPA is part of the executive branch, but the president may be on a different page on this.
Well, I think we need to put this on legislation that is going to pass and get the president's signature. That's what I'm working for, because I want this to become law.
But could that happen? I mean, could y'all come together, in a bipartisan way, including the three I mentioned from the U.S. Senate who are Democrats and the Democratic president?
It would have to be, I think, tied to additional legislation that the president wants to see passed. I don't know if standing alone it would pass, because the president has been pretty authoritative and dictatorial, if you will, on issues of emissions. We see this in Wyoming with what this president has done to the coal industry in Wyoming, fighting our energy industry, and we are the energy capital of the world. So I would expect also on water, the president is going to be pretty dug in, and we're heading in the opposite direction. We think the control ought to be at the local level, and that Washington shouldn't be making these decisions about water in Wyoming.
His name is Dr. John Barrasso. He is a member of the U.S. Senate from Wyoming. My name is Brad Pomerance. It's Charter Local Edition.